Hey there, cat guardians! We love our feline friends for their independence and mysterious ways. But sometimes those behaviors can mask health problems. We'll delve into 20 warning signs your cat might need help. Recognize these signs early to get your furry friend the care they need. So grab your feline friend, get comfy, and let's dive in. One of the biggest indicators of trouble in your cat's world is a sudden change in appetite. A sudden decrease in appetite can be a sign of dental problems, stress, or even a more serious underlying illness. On the other hand, an increase in appetite can sometimes point to metabolic disorders like hyperthyroidism. If their eating habits change dramatically, don't just chalk it up to being a finicky feline. Get them checked out by your veterinarian to rule out any potential health concerns. Cats are naturally fastidious creatures, but there's a fine line between healthy grooming and overdoing it. Overgrooming can be a sign of stress, allergies, parasites, or even skin conditions. Cats may overgroom as a way to soothe themselves when they're feeling anxious or uncomfortable. Take note of where your cat is grooming excessively, as this can provide clues about the underlying cause. If you notice any bald patches, redness, or irritation, it's crucial to consult your veterinarian. We all have our lazy days, but if your playful cat suddenly becomes a couch potato, take notice. Lethargy can signal something's off. Monitor their behavior closely and consult your vet to rule out medical issues. Cats are natural hiders. It's in their DNA to seek out cozy, enclosed spaces where they feel safe and secure. However, if your normally social butterfly suddenly becomes a recluse, it could be a sign that something is amiss. Hiding can be a cat's way of coping with stress, fear, or pain. If your cat suddenly starts hiding more than usual, especially if they're avoiding interaction or seem withdrawn, it's essential to take it seriously. While we often joke about cats being aloof and independent, aggression is never normal behavior. If your affectionate feline starts hissing, growling, biting, or scratching, it's a sign something is wrong. Often, sudden aggression is due to pain or discomfort. Consult your vet to rule out any medical conditions. Cats are masters of communication. Their meows, purrs, and chirps speak volumes. Changes in vocalizations can indicate problems. Excessive meowing may signal stress, anxiety, or cognitive decline. A sudden decrease in vocalization can also be a red flag. Consult your veterinarian if you notice anything unusual. Just like with humans, unexplained weight loss in cats is never a good sign. Weight loss can be a symptom of various underlying health conditions, including dental problems, parasites, diabetes, hyperthyroidism, kidney disease, and even cancer. Keep a close eye on your cat's weight, and if you notice any significant changes, consult your veterinarian. Early detection and diagnosis are essential for providing your cat with the best possible outcome. We've all seen our cats hack up a hairball, but frequent vomiting is not normal. If your cat vomits more than once a month, consult your veterinarian. Causes include hairballs, parasites, infections, and serious conditions like kidney disease. Track frequency and symptoms to help your vet determine the cause. While an occasional loose stool might not be a cause for alarm, persistent diarrhea is a definite red flag. Diarrhea can be caused by a variety of factors, including dietary changes, stress, parasites, bacterial infections, inflammatory bowel disease, and even cancer. If you notice blood or mucus in your cat's stool, or if they seem to be straining to defecate, contact your veterinarian immediately. Cats are creatures of habit, especially when it comes to their litter box routines. Any changes in these habits, such as urinating outside the box, straining to urinate, or having accidents, should never be ignored. These changes can be signs of urinary tract infections, bladder stones, stress, or other medical conditions that make urination painful or difficult. If you notice your cat squatting frequently, crying out while urinating, or licking their genital area excessively, contact your veterinarian immediately. Now, let's be honest, no one expects their cat's breath to smell minty fresh. But if it becomes foul or putrid, it's time for a dental checkup. Bad breath can be a sign of dental disease, including brushing your cat's teeth and providing dental chews. Cats love to scratch, it's in their nature. But if you notice your cat scratching excessively, to the point of causing hair loss or skin irritation, it's time to investigate. Excessive scratching can be a sign of allergies, parasites like fleas or mites, dry skin, or even behavioral issues like stress and anxiety. Take note of where your cat is scratching most frequently. If it's concentrated in one area, it could indicate a localized problem. A limping cat is never a good sign. Whether it's a sudden injury or a gradual onset of lameness, it's crucial to have your cat examined by a veterinarian. Limping can be caused by a variety of factors, including sprains, strains, fractures, arthritis, infections, and even nerve damage. Observe your cat closely to determine the severity of the limp and whether it's affecting one leg or multiple limbs. Any unexplained swelling on your cat's body should always be checked by a veterinarian. Whether it's a lump under the skin, a swollen paw, or an enlarged abdomen, it's essential to rule out any serious underlying conditions. Swelling can be caused by a variety of factors, including infections, abscesses, insect bites, allergic reactions, and even tumors. Take note of the location, size, and consistency of the swelling, as well as any other symptoms your cat might be exhibiting. While a little bit of clear discharge from the eyes is normal in cats, excessive tearing, crusty discharge, or any discoloration of the discharge should be addressed. Eye discharge can be a sign of conjunctivitis, allergies, infections, corneal ulcers, or other eye conditions. If the discharge is accompanied by redness, swelling, squinting, or pawing at the eyes, it's important to seek veterinary attention promptly. Just like us, cats can sneeze occasionally, especially after a good dust bunny hunting session. However, frequent or persistent sneezing, especially if it's accompanied by other respiratory symptoms, should not be ignored. Sneezing can be a sign of upper respiratory infections, allergies, irritants like dust or smoke, or even more serious conditions like nasal polyps or tumors. If your cat's sneezing is accompanied by discharge from the nose, coughing, or difficulty breathing, consult your veterinarian. While not as common as sneezing, coughing in cats is never normal and should always be taken seriously. If your cat develops a cough, it's essential to consult your veterinarian to determine the underlying cause. Coughing can be a symptom of various conditions, including heartworm disease, asthma, bronchitis, pneumonia, and even heart failure. Listen carefully to the sound of your cat's cough. A harsh, dry cough can indicate an irritant, while a moist, productive cough might suggest an infection. A healthy cat should have a shiny, smooth coat. If you notice any changes in your cat's coat texture, such as dullness, matting, excessive shedding, or bald patches, it could be a sign of an underlying health issue. Changes in coat condition can be caused by poor nutrition, allergies, parasites, hormonal imbalances, stress, or other medical conditions. Pay attention to the distribution of the coat changes. If it's localized to one area, it might indicate a local problem, while generalized changes could suggest a systemic issue. While cats aren't known for their love of water, a sudden increase in thirst can be a concerning sign. If you notice your cat drinking excessively or their water bowl is constantly empty, it's crucial to consult your veterinarian. Increased thirst, also known as polydipsia, can be a symptom of several medical conditions, including kidney disease, diabetes, hyperthyroidism, and urinary tract infections. Keep an eye on how much water your cat is drinking and whether they're urinating more frequently or in larger volumes than usual. And finally, one of the most important things to remember is that any sudden or drastic changes in your cat's behavior should be taken seriously. Cats are creatures of habit, and even subtle shifts in their routine can indicate that something is amiss. Whether it's a change in their sleep patterns, litter box habits, grooming routine, or interactions with you, it's essential to trust your instincts. You know your cat better than anyone else. If something feels off, don't hesitate to consult your veterinarian. So there you have it, 20 warning signs your cat might need help. Early detection is key. Pay attention to your cat's behavior. Contact your vet if you notice any signs. Trust your gut and err on the side of caution.